We're talking about the 340B Discount Drug Pricing Program with Karen Bowling, Executive Vice President of Government Affairs for the West Virginia University Health System and President and CEO of WVU Medicine Princeton Community Hospital. Karen, thanks for joining us.
Oh, I'm very happy to be here today. This is a subject that's near and dear to my heart. I think it's a very important subject to be talking about.
Great. Well, we are going to be doing some myth busting today on the 340B program. We want to make sure everyone understands how it works and how it's funded. So let's start with the basics. What is the 340B program and what is the goal of the program?
Well, the goal of the program really is to be able to support and help individuals in underserved communities, rural communities throughout the country. The program was put together in 1992 under President Bush. And really the idea behind the program is how can we support and help communities? The program is a discount drug program for covered entities. And a lot of people have questions about, well, what is a covered entity? A covered entity must meet certain criteria. And part of that criteria is really about the type of patients that they serve in a particular state or in a particular community. If they meet that criteria as a covered entity, then the pharmaceutical industry must sell to those covered entities certain medications which are defined by the federal statute at a discounted price. That way that covered entity can use those funds to really help their communities. I think sometimes people think that it's a direct discount on a drug to the patient, and that isn't the way it works all the time because the covered entities have options that are again defined by statute of how they can use those funds to benefit their communities.
All right, good to know. So there does sometimes seem to be some confusion surrounding this program. So let's get all those myths busted today. All right, let's start with, here's the first myth. The 340B program is funded by the American taxpayer.
Absolutely not true. This program is actually funded by the pharmaceutical industry. And we talk a lot about that. You know, if you looked at the pharmaceutical industry and their margins, they do okay. And so the ability for them to give back a little bit to communities that are underserved, I think is very important. It would be different if they had a margin of 0, but they don't. You know, pharmaceutical companies can have margins up into the 30%. So this little bit that they do to discount certain drugs really allows covered entities to provide services in communities in need. And that's what's important about the program. There are no dollars that are spent by the federal government or the state government to fund this program. It is all funded by the pharmaceutical industry.
That's a really good point. That's a big one. Okay, here's myth number 2. The 340B is unregulated, which has allowed participants like hospitals to misuse it.
Absolutely untrue. Again, this program is highly regulated. It's a government oversight is required. And so HHS has rules. They have audits. At WVU Medicine in particular, we have a full team of people that audit and ensure our claims are accurate because we want to make sure that if HRSA comes in to do an audit, that we know that everything we've done is above board. And so this is a highly regulated program where there are very specific guidelines that must be followed. And when those guidelines are followed, then in essence, you get a check mark to be able to continue to use the funds that are delineated in a manner in which also is described by the federal government. If for any reason you are audited and found to be in non-compliance, then there are consequences to that. So yes, it is a highly regulated and there's a lot of oversight for this program. And most covered entities that have this program also audit themselves.
Okay. Myth number 3, abuse of the 340B program has led to its growth.
Absolutely, again, not true. If you think about it, this program grows because if you look at our country today, sadly, there are many areas that are underserved. And so if there are a lot of underserved, there's going to be more covered entities. And these covered entities, which of course, as we've already said, must meet certain guidelines, are going to be able to get the discounted drug prices to use to help their communities. And there are a lot of programs out there, and it's not just hospitals, by the way. We also have federally qualified clinics that are covered entities under 340B, as well as some other programs. And so, again, if you're a covered entity, then you have guidelines, and if you meet those guidelines, you can expand your program. And if there are, again, a lot of areas where there are underserved Americans, then clearly the program is going to grow based on that.
Okay. One more myth here. The current 340B reform proposals would help patients.
Absolutely not. Most of the proposals that are out there have nothing to do with patients. They have everything to do with the pharmaceutical industry wanting to stop the program or diminish the program or stop paying for the program itself. And so we believe that most of the reforms out there are really dangerous. The other thing I will tell you is a lot of those reforms add administrative burden. When you add administrative burden, in essence, you're taking away from the patients because we're having to spend dollars on people to manage the program, when in reality, this program should be a pass-through, easily administered, so that the funds go to the covered entities to use for the purpose in which it's intended, which is to help this underserved population. You know, there are many covered entities out there that use these funds for a lot of different types of programs. You know, there could be, in our case, Bonnie's Bus. We have Lucas, which is our lung screening program. A lot of our hospitals do health fairs where they provide free screenings. Many hospitals have programs for charity care for our patients, so no one is turned away. If I have cancer and I need a very high dollar chemotherapy, these types of programs with 340B allow us to be able to provide those services to people who come into our hospitals to be cared for. So this is an important program, and this program cannot be reformed to the point that it's diminishing the savings, because once the savings are diminished, that's when hospitals, unfortunately, have to stop doing some of these very important programs.
Well, that makes a lot of sense. So before we go, what's the most important thing you want people to know and understand about the 340B program?
I think just to know that the 340B program is designed to ensure that covered entities can receive savings from the pharmaceutical companies, and that those savings can be used to help those communities. This program is important to hospitals, community health centers across this country. Over-regulation with additional reforms or things that, you know, we're hearing some of the folks in Congress talk about could really hurt these communities. And these communities are already hurting. These communities need those funds so that, again, we can continue to offer programs free or at a discount. And we want our communities to be served. We need many of the programs that are out there. And the flexibility of the 340B program is that a covered entity that meets criteria can use those funds and tailor it to their communities. You know, in some communities, as an example, you know, maybe the most important thing is to use those funds for a free clinic. In another community, it might be for screenings. And so we have to have that flexibility to use those funds to help each individual community. And every community is different. So that's what I want people to know. This is not funded by taxpayers. This is funded by the pharmaceutical industry, and that the covered entities need those funds to continue to provide the services that are necessary in their communities.
All right. Well, Karen, thank you so much for sharing this important information and clearing up all those myths. And thank you for watching this video.